Hey everyone, I just wanted to say today is the last episode that will be put out for the Greeners podcast. It's been bittersweet, but it is time to close this chapter. This episode will feature none other than the amazing Minister of Health, former Minister of Health, Mark Holland. We had the opportunity to interview him, and it was such a great interview, and unfortunately we couldn't get it out in a timely manner. But you'll get to hear it today. He had some great suggestions at the time, and maybe the new minister that will be coming forward will be able to implement some of these things and continue to have nurses at the forefront of her mind. Because again, there are lots of challenges in nursing, and we need to be able to face them head on and have the federal government's perspective, always keeping their minds and nurses in their minds. So, without further ado, here is the final episode of the Gritty Nurse podcast. Is this thing still on?
Sounds like they heard us. We are seeing some change.
We need to continue to disrupt the status quo.
And now the work begins.
You are now about to witness the strength of nursing knowledge.
Welcome to the Gritty Nurse Podcast, an unfiltered discussion on health and healthcare. My name is Sarah Fung.
My name is Amie Archibald-Varley, and we are your hosts. Our Toronto Star and the Globe and Mail national best-selling book is available now. Get your copy of The Wisdom of Nurses today. You can get a book for purchase at any of your local retailers like Indigo or Chapters, or pick up your book online through Amazon or other types of retailers. It's also available in various different formats like audiobook and on Kindle. If you read it and you loved it, please leave us a review.
Please make sure you subscribe on our YouTube channel where you can watch our podcast in video format. Like, share, and leave a review. If you're listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, leave us a rating and review. Thank you to all our listeners and sponsors who continue to support us.
Your support makes our podcast possible, and we're grateful for the partnership and for you believing in our work here at the Gritty Nurse Podcast. Stay gritty. So we're so excited to have our guest, Minister Mark Holland, coming on to our podcast. And, I think we should just get right to the questions that we have to talk about today. The Honorable Mark Holland was first elected as a member of the Parliament for Ajax in 2004, serving until 2011, and was re-elected in 2015, 2019, and 2021. A lifelong resident of the Ajax-Pickering area, Minister Holland has served his community for over 20 years. Before entering federal politics, he was elected as Durham Regional Councillor, serving from 1997 to 2004. As a member of Parliament, Minister Holland has served in many roles, including as the leader of the government in the House of Commons, as Chief Government Whip. He has also been a staunch advocate for marriage equality rights and played a key role in helping to reform Canada's animal cruelty laws. In both public and private roles, Minister Holland has backed health initiatives, serving as Executive Director of the Heart and Stroke Foundation of Canada's Ontario Mission, as well as the National Director of Children and Youth. As Minister of Health, Minister Holland has worked to sign bilateral healthcare funding agreements with provinces and territories to improve healthcare access across the country. He's also launched the Canadian Dental Care Plan that will help up to 9 million Canadians get the essential dental care they need, and recently has introduced Pharmacare legislation that will provide universal access to contraceptive and diabetes medications. Welcome, Minister Holland. So healthcare is on the ballot. And it's one of the most talked about issues all across Canada. Canadians are concerned about healthcare. So, Mark, what do you have to say in terms of what would you say 3 significant things that the federal government is working on right now to make Canadians healthcare or to make Canadians overall healthier?
Well, yeah, thanks so much. I was so glad to be here, both Amie and Sarah. So I appreciate the question. You're absolutely right. It's going to be on the ballot, and it should be on the ballot. This is, one of the top issues for a very important reason. I mean, all of us rely on our health system, and and it doesn't matter whether or not you're talking about your personal lives or your professional lives. Having a good health is so essential. And so it's a matter of productivity, it's a matter of economic growth, and it's a matter of social justice. So it doesn't matter what part of the political spectrum you're coming from, it's so essential. And I think all of us know that our health system has all of this latent potential. It's doing all of these great things, but that it isn't delivering in the way that it really needs to. And by that specifically, we have an illness-based system. We wait for people to get sick. And then we spend egregious amounts of money and human resources dealing with those ill people. And this is so tragic when we know that 70% of chronic disease and illness, as an example, are preventable. That most of the things that are in our waiting rooms and are in our hospitals shouldn't be there. And so we need a very concerted effort towards wellness, to move towards prevention, to make sure that our systems are digital and not analog and are interconnected, and that we are supporting a health workforce that frankly is deeply tired, has carried an unbelievable amount. So let's be a little more granular. For me, a couple of the things that are really important in that journey are Pharmacare, as an example. We signed the first deal with Manitoba. We got more coming. We need to see that in every province and every territory. And this is, yes, it's about diabetes medication and it's about contraceptives, and I can speak to those. They're incredibly important. But in Manitoba, we also see HIV/AIDS drugs covered. We also see hormone replacement therapy, which, every woman is going to go through menopause. Being able to have the medication that she needs to be able to manage that process is critical, so that she can be with her family and that she can be productive and not sidelined. So we're then going to be able to build evaluation around that, really show what kind of difference that makes to our health system. The other thing that we're going to continue to work on is dental care. We've delivered 1.5 million new Canadians having access to dental care. They've gone in and seen a dentist. And we're finding oral cancers, we're identifying hypertension, we're seeing people get smiles they're proud of. Talking to folks who've had the same set of dentures for 30 or 40 years. Like, I don't know.
Yep.
I had no idea this was going on.
Yep.
30 or 40 years, the same pair of teeth in their mouth, down to plastic plates in their mouth where every bite is pain. And now they got a new pair of teeth. And they're setting up photographs with their families. They're filled with joy and confidence. So it isn't just the social justice of that. Imagine for that person with that set of teeth, what it does to their confidence in a job interview, what it does to their confidence when they're standing up against injustice or somebody trying to attack them. The sense hearing from them, they feel seen and cared for and appreciated, how that lives and creates a different feeling for me, even about our country. I'm just proud to be in a country where those things are happening.
Right.
So, and I could go on and on and on, but there are some really important points of transformation, and there are things that really fire me up, as you can tell.
Yeah.
That's amazing. I think you touched on some really important points in terms of making healthcare more accessible for people that need it the most. And you mentioned something about a concerted effort. So I think part of what we're dealing with is a fragmented user experience where people have to navigate the system. And I always say that in a perfect world, we shouldn't have to navigate anything. It should just be something that's easy to experience, right? So one of the things that Amie and I talk about is just the prevalence of silos in healthcare, where there are, a lot of different organizations and systems that don't talk to other systems. And I think staffing ratios in BC and protections against sexual violence in Quebec are things that are at the forefront. So I'm just wondering, in terms of reducing silos and kind of making more of a concerted effort, how do you see that happening right now?
Sure, it's a great question, Sarah, and I couldn't agree with you more. We just got back from Halifax, all of the health ministers getting together, and both in Charlottetown a year before that, and now in Halifax, when we've been getting together as health ministers, we're talking the same language. And one of the things that we need to stop doing is start, well, that's this person's jurisdiction or that's that person's jurisdiction. People are so sick of hearing that. We need a health system that's all pulling in the same direction with a common purpose and finding ways to work together. And so when somebody tells me there's a problem, I immediately take it on my shoulders to help find a solution. And I think, yes, we should all be evaluated. We're talking about an election. We should all be evaluated against the work that we're doing. But if somebody elects a provincial government, it doesn't matter if I don't like them or don't think that they're doing a good enough job. They're there. It's my job to work with them and find common ground. And so interoperability, interconnection, knocking down silos has to be a first priority. And with everything that's going on, with the threat of a trade war with the United States, knocking down internal barriers just makes good sense. So for me, pan-Canadian licensure, you're talking about if a nurse moves from, from Halifax to Vancouver, having to wait months for that nurse to be able to practice is bananas. Makes absolutely no sense. But let me go another step, because you're talking about the patient journey, Sarah, and this is so important. Right now we have an analog system. We're using fax machines, we're duplicate, triplicate forms. Healthcare workers are being burnt out by nonsensical bureaucracy that is legacy systems that need to be ripped out of the ground. I think the federal government should be playing a role in that transformation so that it is totally connected. And it does a bunch of things. Once we have an interoperable digital system where all of this information can flow without block or barriers, then we can start to deploy modern solutions like AI to do the work of pulling people through that patient journey, of making sure that your chart gets to the right place and that follow-up appointment is followed up on, and that the information is flowing correctly, and that you have access to your patient record. And what ends up happening in the future, if we do that, imagine in a few years, we're going to be able to sequence the human genome for every person in this country. Right now, we're just doing it for folks who are predisposed for genetic illnesses. You're going to be able, if you choose, to have all of that information in one record. And then you're beginning to say, well, wait a second, you saw your dentist and they mentioned you had an issue here, and you saw your pharmacist and there was an issue here, and you saw your nurse practitioner and they said you had and all of these different visits matched with your human genome. You're going to say, well, actually, it looks like you're at risk for X condition or X disease. You really should go get screened. And so all of that interoperability and connection not only improves the patient experience, not only makes that information flow better so that we don't have people lost in the cracks, but also is going to be able to be deployed for prevention. Europe is way ahead of us on this. Europe is already interconnected. Canada must drive that. We must do it. So I'm sorry to be so long-winded, but it is such an important piece of this solution, and we have to drive that as fast as possible.
No, I'm glad that you said all of those things, because one of the things that we talk about in healthcare is this kind of translation, like knowledge to translation gap, where it's like, okay, we have the science of that this is going to work, and and then it takes us 15 years for us to actually implement it. So again, I think that's something that we need to look forward to saying, okay, so we have the tools, how do we use them? Or, why are we working in silos? Why aren't we having conversations? Because that's really where innovation sometimes, really lives, where it's like, oh, hey, that jurisdiction's doing this, that it's working. Well, why aren't we, borrowing from them? Why aren't we actually doing the same thing? And I really am looking forward to seeing how our healthcare ministers will work together. Because you can have dissenting views, but again, I think healthcare should be nonpartisan. We're talking about people's lives. We're talking about, like you said, making a healthier Canada. And I think that, we should be, working alongside of each other in relation to these issues. And you also brought up another hugely critical and important part in terms of nursing, right? I think that one of the things is it should not be that difficult from a nurse that works from one province to another to have to go all through that bureaucracy and red tape. So I'm looking forward to seeing like that we should have a pan-Canadian licenseship, and kind of expanding on that. So we have, as nurses, we have to talk about this national nursing shortage that we have. And I think one of the biggest things is the challenges. We know how many nurses are registered and licensed and work, but we don't know necessarily where they're working and where they're coming and going, whether they are, although they might be registered, are they actually like actively, working in a community setting? And I think all of these things play into some of the questions that we have today and how many other Canadians have. So has the government thought about any plans to continue to incorporate nursing or nursing roles to support the ongoing shortage related to primary care? And can we rely on seeing more nurses playing active roles within the federal government? I think we should see them in federal government, provincial government. Nurses need to be everywhere. What are your thoughts, Mark?
Yeah, Amie, couldn't agree more. Nurses do need to be everywhere. Dr. Lee Chapman, who, as you know, is a nurse and just such a special person, is our chief nursing officer. And one of the things that we did is establish a chief nursing officer so that there was a voice for nurses directly within government. And Lee has just been a superstar. She has been so helpful in building a lot of those bridges that you're talking about building the nurse retention toolkit to really help organizations understand what they need to do to support and retain nurses. Because I mean, as you know, Amie, and you would say it much better than me, but like you can't fill a bucket with a hole in it. So,
Right.
it's not just about hiring nurses, it's about giving them the highest quality experience possible. And they have borne like such a load through COVID and the aftermath of COVID. And frankly, even before it, we had a lot of fracture lines that we just weren't looking at, that we didn't want to acknowledge. And so COVID ripped those open and really put our system in a state of crisis. And so for me, yes, having Lee there, who's just extraordinary, is huge. But the other piece is, is a couple of things. One, we have these bilateral agreements that we've signed where provinces have made specific commitments to close these gaps and actually show in data what we're dealing with. So for the first time in Halifax, we released what is the shortage of nurses numerically in every province. And then now we're annually going to get a report on how we're closing that gap. The other thing that we have, and obviously in our bilateral agreements, we gave $200 billion over the next 10 years to help on health workforce and to help on closing this gap. So on that and other issues, obviously, that I could talk about, but nursing was certainly a very important component of it. The other piece that I think is really critical is the piece around scope and team-based care and changing how we use nurses to make sure that they're practicing at top of scope. It makes no sense for us to have a nurse practitioner, as an example, who could be delivering all of these services being used in an inefficient way. And I talked to nurses are, they're both dealing in science and art, because every situation you deal with is unique and different, and they need the tools to be able to respond to that. And I think having not just more nurses, but also giving them more freedom in their scope of practice is extremely important. And then the other thing that we've done is created Health Workforce Canada that maps out the health workforce needs in the future. And this was, I mean, it's bananas to say this, but it was never done before. So what we now have is an agency that's responsible for saying, in 10 years, this is how many nurses we're going to need. And so we're going to have to go back to think not just on sort of the colleges and how many nurses are graduating, but also in terms of our immigration and other policies. How are we going to meet that need? And because we have an aging population, so we're going to have an increasing need for nurses. So it's not just about how do you fix the problem right now? How do you make sure that we never wind up in it again, and that we're always looking 5, 10, 15, 20 years out to make sure that we're managing those curves? Because, if you talk to a nurse who's worked 30 years, they're going to tell you there's some years where, actually there's, there's lots of nurses and it isn't too difficult. And then there's other years where it's madness, right? And no one is kind of matching those peaks and valleys. We got to eliminate that. That is not something nurses should be experiencing. And that is frankly a lack of planning. And that's what Health Workforce Canada is about.
Yeah, I definitely want to add there for our listeners in terms of some of the context, because I think it's so challenging again when we're looking at from like a federal perspective, and then when you boil it down, like you had mentioned, like Dr. Lee Chapman has created the nursing toolkit. Again, it's now to the provinces to actually do the work. So again, we're always pressing to say, hey, okay, this great work is out there, but we need the provinces to move on them. So I just want to throw that out there, because that is another part of the challenge. It's like, okay, so federally we have a document, but now it's like to compel folks to actually move and act on it, because at the end of the day, although that document lives, if no one does anything with it, it's very challenging and frustrating, because again, I don't think the issue is nurses willing to work. It's the retention. It's keeping us in a place where, like you mentioned, that yes, we have peaks and valleys, but right now it's kind of a low. And how do we keep going in knowing that, this is the job that we love, but there aren't those tools to continue to retain us. So again, another push to the provincial governments, and again, just for that collective conversation to happen federally as well, to say, hey, this is what needs to be done. We need to see some more accountability. But I'll pass it to Sara now.
Yeah, and I really appreciate what you said about looking ahead, because I think a lot of what I've experienced in healthcare is very reactive versus proactive. Yeah. We're always in crisis mode. We're always putting out fires. We're just trying to keep our heads above water, and we can never get to a point where we're able to actually plan ahead or prevent things from happening. And the other piece of it is I think there is a shortage in terms of nurses qualified to teach nursing students and put them through placements. So this shortage is actually occurring on all fronts, right? Like there are nurses that want to go to nursing school, but they can't find the teachers to teach them. The experienced nurses have left and they're not coming back. So I think there's a whole lot of issues we're dealing with right now. And also, I do feel like the US is ahead of us in a lot of ways when it comes to licensure. Like, as you may know, they have a compact licensure where nurses can pretty much flow from one state to another, just having a single license. So I think that would definitely help with the whole workforce issue in some respect. I just wanted to switch gears a little bit and talk about health misinformation because I think this is a big thing now with the digital age that we're in. Patients have access to so much information. It's often crippling because there's so much out there. You don't know what's accurate, you don't know what's reputable, you don't know really like where do I go for the information I need. And I think that's part of the issue. So in terms of it being harder to decipher what is harmful and what is helpful, does the federal government have a plan to deal with this misinformation that we're in? And, how do we move forward from where we are right now?
Yeah, and if they don't, we do. I'm joking. Go ahead, Mark.
Yeah, I mean, it's such an important question, Sarah. Like, I think one of those things that, talk about things that keep you up at night. This is one of them because, misinformation and disinformation is so deadly, and we're seeing it play out all over the place. But in health, it kills people. We just had somebody die of measles. We've got outbreaks in this country of measles. This is entirely preventable. It is devastating to me that we're seeing this happen. And so I think there's a couple of things. One is building up community support and capacity to be able to reach people at a community level, to talk to them directly. A lot of times people wind up in these misinformation holes because they don't have the trusted connections at a community level to professional health advice. And so I look at, a primary care, and we've got not people have, there's many, many things that are working in our health system that are absolutely remarkable, and we need to celebrate them. Otherwise, there are people who will try to just throw the whole thing out. But the thing that we're not doing nearly good enough job on is primary care. And we know what we need to do, and we know it's going to save boatloads of money to do it, is to create team-based models where people can go in and they're going to go and, you're going to start your journey maybe with your nurse practitioner. You're going to have your pharmacist in the same space, a doctor in the same space. You're going to have a psychotherapist there. The idea is to have a whole team of people so that when you go in, you build trusted relationships at a local level, and you can go in early. Right now, somebody has a problem and they're like, well, it's going to be a hassle. I don't know how long is it going to get me to see somebody. So I'm just going to go on Google and I'm going to see what I find. And so it's not a mystery why people wind up in these places. And the second thing is that it could be, I really think we have to be very careful in politics. Amie, you said something very important earlier. Healthcare is not political. And I think what I really try, I don't always succeed, but I really try to talk about everything from a health perspective and from a science, data, and evidence perspective. And to say that, we should, when we're talking about voting on health, we should reward the people who talk the most in science, data, evidence, who actually show progress and who don't politicize these issues, because it is so injurious to politicize it, because then it creates real confusion, so it's very easy to fall into that. Like I can have a difference, very big difference, with my counterpart on the other side. And how I have to think about, okay, how do I engage in that argument in an evidence data-based way instead of an emotive partisan way? And to recognize that I have a special responsibility as a health minister that, is to kind of approach it in that direction. And I think it's been easier with the provinces. I have to say, like in Halifax, it was just a couple of weeks ago, we're able to speak with the same voice about the type of health transformation that needs to occur. We're able to talk about, about what needs to be done in terms of vaccinations and prevention. And, can we do a better job? Yes. I think there's still some gaps there. But dialing down the political rhetoric is really important. And then the third thing is, the resources that we can have as a public health agency to connect people. And, the role that Teresa Tam played, and Teresa's, retiring. So we're going to have a new chief public health officer as sort of that chief voice to say to people, we got to return to, hopefully people look at the measles outbreak just as an example and say, okay, maybe I need to be listening to scientists and to nurses and doctors on these issues as opposed to Reddit. And so, I think overall we were living through a very scary time in COVID where people didn't have a lot of answers. Like, I think we have to have a lot of sympathy for people. You remember the beginning of COVID, we didn't know, like, there was so much that was unknown, and we didn't have the data or the science and evidence. So people were taking guesses into the night, and that created a lot of uncertainty. But, as a species, we've only ever succeeded when we rely on what is true and what is based in evidence.
Yeah, no, I completely agree with that. And I think that, like, I do, like you mentioned, Mark, I do want to acknowledge the fact that, there was a lot of fear and hesitancy. And again, like, even within our own profession, the whole idea of, the precautionary principle that even was thrown out of the window. Like, we should be, using all the PPE when we first started. And we just didn't know what we didn't know. And again, I think it really boils down to, like what you said, that we do need to follow the science and the evidence. We do need to look at what the evidence-based practices are. And again, this really ties into the previous question about health literacy, making sure that people can find factual information, because there has been some mistrust. And I think it's important, even though we would say like healthcare should not be political, that our governments do regain trust with the general public in relation to delivering health information, or whatever the case may be, because I think that we do have an issue in that area, and we have to be able to address it. And again, it is talking about what evidence-based research says, and again, making sure that we can point people to the right data points and the right evidence, and kind of tailoring off of what you said too. So you mentioned measles, and we have to talk. We have to talk about this. And there is concern from Canadians at our borders in relation to disease. You mentioned that, it was very unfortunate that just recently there hasn't been a death in over 10 years in the US of measles, and it was a pediatric patient who died. And there's concerns in relation to some of the rhetoric that we hear out there. There is a confirmed HHS US government official, RFK, who has spread misinformation. So, what would you say? Is Canada ready to protect the health of our citizens from the missteps of the U.S. health authorities?
Yeah, thank you, Amie. And I think, I spend so much of my time domestically. I'm always on the road, and it's always in some part of Canada.
Right.
I've only, in my year and a half, I only left the country once, and that was to go to the G7 and have a conversation there with my partners. But I acknowledge I need to really amplify now. Secretary Becerra was doing an incredible job, sort of leading on the pandemic instrument internationally and antimicrobial resistance. So Secretary Becerra and that was another trip I did take. I was in Washington meeting with Secretary Becerra when we were dealing with the issue around dogs. As you might remember, they were going to block our dogs from going across the border. But it's clear that I'm going to need to spend a lot more time, if Canadians decide to continue us in this role, and I'm continue to be the health minister, on multilateral processes. And let me give you a few reasons why that's so important. I think you've mentioned one of them, which is this question around an outbreak of something like measles or tuberculosis, or things that we had largely beaten, that had almost been eradicated, that now, because people aren't getting vaccinated, are starting to come back. It's not just that those people are at risk, right? Which is terrible and tragic and unnecessary in and of itself. It's that when you allow a disease to return, it can mutate, it can evolve. And this is what these diseases do. And that means that they can overcome our existing defenses, which means suddenly everybody's at risk. And, can you imagine in a world where these measles outbreaks are allowed to continue, and then it mutates in a way where our existing vaccine protection isn't effective? You look at penicillin and antimicrobial resistance, like right now we've got a huge problem with an overprescription of penicillin, and this means that basically our defenses against it are failing, and we know that it's failing, and we need to
Yeah.
work as a planet to create the solutions that are going to get us out of this. And if we don't, like tens of millions of people are going to die, right?
Yeah.
And so this is what happens is that if we're not, we can't find that solution alone in Canada. Like that's not going
Yeah.
to be a solution that we're going to be able to do alone. Like we need to work with the rest of the planet. And given the fact that there isn't an evident leader globally on this anymore, that we can't bemoan that. We have to go and fill that space. And my feeling is that if we go in and we fill that space and we talk in science and data and evidence and reason, that people are going to connect with that. And that we're going to be able to get through this moment in time when people are just really scared. Because I think when we can look at this and we can be all really worried about the direction of the world, but it is common in human history that when things are at their most uncertain, people are at their most fearful, which
Right.
means they're most dysregulated, which means that they're making the least logical decisions. And in those moments, we need to be calm, we need to be rooted in evidence, and we need Canada to lead. So,
Yeah.
this means that I'm going to need to be, if given the opportunity to continue in this job, much more present on the international stage, pushing in multilateral forums to find international consensus to tamp these things down and make sure that we're collaborating so that we're finding the solutions together to protect our overall health. Because, if you take H5N1, the avian flu, this is not something that we can, no matter if we do everything right in Canada, that's not good enough, right? If it is being managed well internationally, then we could be back in another pandemic. So we can't just rely on, maybe we were too reliant on, one country or the World Health Organization to take this leadership. As the US pulls out of the World Health Organization, as they're being less involved in multilateral fora, then that means we have a greater responsibility as Canada, not just because we care about those other people and should care about those other people in the rest of the world, because it's vital to our own defense and protection of our health.
Hmm. I think
Yeah.
you
I
brought up a
mean,
lot of good points, and I think there's definitely a
yeah.
lot at
Yeah.
stake here.
I would say you can't. I was gonna say I don't think I've heard a better answer, in relation to the fact that I completely stand with you in terms of I think Canada should be, leaders now, right? I think that, like you said, Mark, maybe we rely too heavily on other organizations, and I think that we have scientists here, we have healthcare experts here. Why not Canada? Why not us to take the lead in healthcare? So I think that you hit the hammer on the head there, and I think that I just think that you're right. Like, I don't really know what else to say. I think that it'll be important for us to take the international stage in relation to healthcare, and to really I hate certain slogans. I hate most slogans, but I do actually like the slogan that we should have a healthy Canada, or making Canada healthy again, not the way that the the US uses it, but I do like the idea that if we are leaders in healthcare, that other people will follow as well. I'll pass it back to you, Sarah.
Yeah, and I think that we did learn a lot from COVID. As bad as it was one example where we all came together quickly. A vaccine was developed. I see the potential in coming together in times of need, and I think we really need to lean on what we learned from the pandemic in order to move forward. So I think, we discussed so much important things today, and I know that there's so much more we could discuss. We could make this a 4-hour podcast if we wanted to. But is there anything, just one thing that you wanted to touch upon that maybe we missed in this conversation today?
Yeah, Sarah, so first of all, thank you. Both Amie and Sarah, this is a wonderful conversation, and I really appreciated the opportunity to be with you here today. Maybe I'll just end on this note, and it's something I say often because it's important to remember. Canada, yes, Amie, is already a leader and needs to be even more a leader in the world. We don't talk nearly enough about health span. Health span is the number of years that we live in health and not in sickness. And in Canada, we're number 2 in the G7, just behind Japan. We have 1 year longer than France and Italy, 2 years longer in health than the United Kingdom, 6 years longer than we live in health than in the United States.
Yeah.
That's an advantage
Wild.
we need to continue to push. We should be number 1 in the world. We should be the best place in the world in which to live a long, healthy, productive life. My mom, I talk about her all the time. She's gonna be 81 this year. She is, tailgating at Bills games. She's going to music concerts. I mean, she's a going concern, and I want that for everybody, right? I think we need to think about our last 10 years of life. I want to be in my 80s with other people in their 80s on a dance floor, loving life and being productive. And that is possible. That is 100% possible for all of us. And it's not just a wonderful, beautiful idea of the type of future that we each will have, because if we're lucky, we're all going to join that demographic.
Right.
It also is going to save us boatloads of money. My mom is still a practicing psychotherapist, doing 25 hours a week of seeing patients, right?
Jeez.
So it's, and she's loving it, right? And you imagine what that difference is. She could be sick and ill and paying all kinds of money to deal with the sickness and illness. So, and that is, we can't avoid everybody having that journey, but we know we can avoid most people having a sickness and illness and being in health. So we should be doing everything in our power to have that. And certainly we should be measuring that alongside of GDP. And I just really want to thank you for your advocacy, because I think if we can connect people to the possibility of this transformation, then we can make it inevitable.
Yeah, no, I agree with you. I think that this is something that is not something that we need. It's something that we want to have. And I think that many Canadians share that same and will echo those same sentiments. So I think that we've got work to do. And I want to be dancing in my 80s.
Yeah.
I want to be going, special nightclubs. Who knows? Right?
Yeah.
But at the end of the day, thank you so much, Mr. Mark Holland, for coming on the Green Nurse podcast to discuss with us the future of healthcare and all these health issues and of course, nursing. And we'll be looking forward to seeing what other work that can be done through the federal government in relation to healthcare. So thank you so much. It was an honor to have you on.
Likewise. Thanks so much, Amie. Thanks, Sarah.
Thank you so much. Thank you for listening to the Gritty Nurse podcast. If you have any suggestions or want to hear a specific topic, email us at grittynurses@gmail.com. That's grittynurses@gmail.com.
We are also speakers and authors available for engagements related to advocacy, nursing, mental health, and health policy. Please connect with us.
We want to take a moment to express our deepest gratitude to our incredible sponsors. Their generous support has been instrumental in making our podcast a reality.
Thanks to their belief in our mission, we're able to bring you engaging content and connect with our amazing community. We're truly grateful for your partnership. Thank you.